Rita Joseph, Narcisse, and De La Rosa. Good afternoon, everyone.
Good afternoon.
It's like school. Rita, you like it? It's like school. Good. Good afternoon and welcome to the Red Room at City Hall. I'm Deputy Speaker Diana Ayala, and I am proud to be a part of the City Council's Maternal Health Steering Committee that has been working closely to confront the maternal mortality crisis here in our city. I want to acknowledge that we're joined today by Speaker Adrian Adams, Council Member, I'll tell you, Narcisse De La Rosa, and Joseph. Now I lost my spot. I also want to recognize my fellow members on the steering committee who are here. Thank you for your persistent focus and commitment to addressing this issue. Today marks the last day of the Black Maternal Health Week, which serves as a stark reminder of the racial disparities in maternal health outcomes that must be confronted. Here in New York City, we lose between 50 to 60 women and birthing people every year during or within 1 year of the end of pregnancy. And Black New Yorkers are 6 times more likely to die of pregnancy-related causes compared to white New Yorkers. These are not just statistics. Every loss of life represents a family and a community torn apart from needless and preventable tragedy. That's why 6 months ago, Speaker Adams established the steering committee to break down the silos and bring together stakeholders to work towards long-term solutions. We have been hard at work talking to advocates, providers, healthcare workers, and fellow elected officials to advance next steps in close coordination. The Council has submitted legislative proposals to our colleagues in the state government that are essential to alleviating this health crisis. We are also continuing our advocacy for investments in the upcoming city budget that will increase health and wellness support for mothers. These are important next steps, and the steering committee will continue our work in pursuit of achieving our shared goal of ending this public health emergency. It won't happen overnight, but we must continue making progress and ensure that our mothers are safe. As one of only 6 women majority legislatures in this country, and with women of color in leading roles, I know that, I'm Councilmember Gutierrez. I know that we have the commitment and life experience to honor this work with the sustained focus that it needs. It will be sustained in the coming months and must continue for years to ensure that it becomes a reality. Now it is my honor to introduce Speaker Adrian Adams.
Thank you. Thank you so much, everyone, and good afternoon. Thank you, Deputy Speaker, for kicking us off. It means a lot to me to gather with this community during Black Maternal Health Week. 6 months ago, we gathered in the aftermath of Beverlyne Garcia Barrios's tragic death due to complications from an emergency C-section. 2 months ago, Tanisha Evans passed away after giving birth to twins at St. John's Episcopal Hospital. Her family also believes that her death is connected to complications from a C-section, but they still haven't received any answers from the hospital. Beverlyne and Tanisha should still be with us here today, and my heart goes out to their loved ones and to those across our city who have been forced to unnecessarily endure such unimaginable loss. Please join me for a moment of silence to remember Beverlyne and Tanisha, as well as the other mothers whose lives have been cut short because of pregnancy-related causes. Thank you. Far too many Black women and others who can become pregnant suffer preventable, life-threatening complications during pregnancy and childbirth because their pain and symptoms are simply ignored. My mother was one of these women, and her pleas for help were dismissed, and she was forced to give birth to me alone on a gurney. I say this often and share this story often because it is truly a miracle that we both survived. Decades later, there hasn't been enough progress. Black women remain disproportionately affected by the disparities in health care that too often cost us our lives. These disparities are a product of long-standing medical and structural racism that make access to adequate health care and treatment out of reach for far too many low-income, immigrant, and Black women. Maternal health is personal to our women-majority City Council. We are all mothers, grandmothers, some of us, and leaders of our communities who know these experiences firsthand, not because we guessed it or imagined it. Ending maternal mortality is a major undertaking, and yet we insist it is possible. The deeply ingrained structural inequities and racism that have existed for decades and are its underlying drivers mean that any single one of us cannot immediately solve it. That's why I convened a maternal health steering committee and continue to assert that maternal mortality is a public health emergency. Success in eroding it requires collective focus by many stakeholders working more collaboratively and urgently. Our steering committee has been working with stakeholders to prioritize interventions that can improve outcomes for families, and we have been advocating for them to be included in the state budget. These include a requirement for community health centers to be reimbursed fully for telehealth services, ensuring these services are widely available. We've also been advocating for annual increases of temporary disability insurance benefits to achieve parity with paid family leave so that pregnant New Yorkers can achieve financial stability. Finally, our state budget should also require Medicaid to automatically authorize coverage for blood pressure monitors without a prescription for pregnant individuals. It only makes sense. This is being considered by many states to empower pregnant people to monitor their blood pressure at home, which can be critical for early detection and management of conditions like preeclampsia, a complication that poses serious risks. New York State should get this done and be a national leader. The Council will also continue to prioritize maternal health investments in our own city budget this year, including fighting for our public hospitals to have at least one maternal health-focused psychologist within each of its maternity departments. Maternal mental health issues are the leading cause of maternal mortality, and if we want to interrupt this public health emergency, we must invest in more mental health care. We're also calling on the administration to increase baseline funding for the city's maternal health program by $15.7 million so that previous cuts are restored and educational outreach and services are expanded. The maternal health crisis continues to be a public health emergency that concerns us all because we know these experiences and many of us have lived them. Mothers are the backbone of our families and the cornerstone of our communities. While we have made positive steps in recent years through increased investments in doula services and mental health care, as well as a guaranteed income program with the Bridge Project for expecting mothers experiencing housing insecurity, we must collectively do more to end this crisis. We simply cannot continue to lose precious lives to preventable causes. Confronting the interconnected issues like poverty, accessible housing, mental health care, and safety that stress the health of mothers and contribute to maternal mortality are critical to ending it. New Yorkers are counting on us. Lives remain at stake. Our commitment to ending maternal mortality must be sustained to overcome the decades of challenges and harm that got us here in the first place. I'm proud of the commitment and work that we're undertaking together in this struggle. And I believe that one day, because of our collective fight and labor, maternal mortality can become an issue of the past, finally. And it will be because of leadership from women in this room and beyond, as well as the many others who look like us, but are no longer here. Thank you.
So Crystal's not here. Okay, Councilmember Rita Joseph.
Thank you, Deputy Speaker. Good afternoon, colleagues, Madam Speaker. As a mother of 4 Black beautiful boys, 2 of whom I've adopted from the foster care system, Black maternal health is not just a policy issue for me, it's deeply personal. It's rooted in my lived experience, in the fears I've carried, and in the hopes I have for a more and just compassionate system for mothers like me. Black women in the United States are 6 times more likely to die from pregnancy-related causes than white women. These are not just numbers. They represent lives lost, families shattered, and futures stolen. These disparities are not due to genetic or chance. They are the results of a system based on implicit bias in our healthcare system and a longstanding neglect of the unique needs of Black mothers. I remember my own journey, being dismissed when I said something felt off, having to advocate fiercely just to be taken seriously. I also remember the emotional weight of adopting 2 of my boys and knowing that trauma they carried was in part rooted in a system that's too often failed Black mothers from the very beginning. Black maternal health is about more than surviving childbirth. It's about thriving in motherhood. It's about ensuring access to comprehensive prenatal and postpartum care, funding for doulas, midwives, mental health support, and care providers who look like us, understands our stories and respect our voices. It's about acknowledging the impact of social determinants like housing, food insecurity, and economic instability that can make pregnancy more dangerous and parenting more difficult. I'm proud to be of this council that is committed to pushing for policies that center Black maternal voices. As a mother, I am determined to make sure that no woman has to face this journey alone or unheard. Because every mother deserves to be seen, supported, and safe, from her first prenatal appointment to long after her baby is born. We cannot say we care about families, children, or equity without addressing the crisis of Black maternal health head on. Our lives and the lives of our children depend on it. Thank you.
This is what happens when women lead. We'll now hear from Patricia Loftman of the New York Midwives and a member of the Maternal Health Steering Committee. Oh my God, Pat, we need the. Yeah, there you go.
Special.
Oops. Thank you so much. Good afternoon. The Reverend Martin Luther King said, "Of all the forms of inequality, injustice in healthcare is the most shocking and humane. Black and brown women and birthing people should not die because they choose motherhood." We are reminded once a year during Black Maternal Health Week that we have a long way to go in providing Black and brown women with pregnancy, labor, and birth experiences that are respectful, incorporates informed consent, shared decision-making, is free of coercion and obstetric violence. The most loving experience in the world should be remembered as safe, satisfying, and one that was blessed and sacred. It's ironic that we don't need to have a white maternal health week, as the data does not indicate a maternal mortality crisis exists for white women. Coincidentally, the same data has historically been true for infant outcomes. Historically, high-income African-American women had higher infant mortality than low-income white women. African-American women who did not smoke cigarettes during pregnancy had higher rates of infant mortality than white women who did. African-American women who initiated prenatal care in the first trimester had higher infant mortality rates than white women with late or no prenatal care. So what accounts for these maternal and infant disparities? I have been a midwife for 43 years. 30 of those years were spent in clinical practice at Harlem Hospital. I am a member of the Maternal Health Steering Committee and a member of the New York City Department of Health and Mental Hygiene Maternal Mortality Review Committee. and have served on the committee since the inception in 2018. After reviewing over 250 cases, the following recurrent themes have emerged. First, the driver of these disparities is racism. I did not need to be a member of the committee, however, to understand that racism accounts for the disparate birth outcomes we see in Black and brown women, because I saw the direct effect that racism plays in their life on a daily basis. Why? Because I was a Black woman before I became a Black midwife. And I understood what racism is and how it manifests itself day after day. Racism is the power to determine the distribution of resources to communities. In other words, who and which community is deserving and which is not. In other words, that determination was made in 1776 and continues to the present day. Racism is operationalized by laws, policies, and practices at institutional, local, state, and federal levels that undergird where one lives, such as residential segregation, determines one's capacity to receive quality primary education that tracks one to higher education, not the prison industrial complex, and employment opportunities that might assure access to healthy food, lifestyle, and quality health care. Racism grinds down and weathers not only the health of Black people, it weathers the health of the Black clinicians. The committee identified that for Black women, the leading cause of pregnancy-associated death, a death from any cause during pregnancy, or within 1 year from the end of pregnancy, regardless of the outcome of the pregnancy, was cardiovascular conditions followed by mental health conditions, which the speaker has discussed. Overdose and suicide was the main cause of the mental health conditions. Overdose was mainly due to opioid disorder fueled by fentanyl use. Over 90% of pregnancy-associated deaths due to mental health conditions were considered preventable. The top contributing factor among 151 deaths were clinical skill, quality of care, and lack of continuity of care and care coordination. I have been a midwife for 43 years. My entire 30 years of clinical practice was spent at Harlem Hospital, attending the reproductive health care of Black and brown women. I began my midwifery journey in 1982, probably a little before some of you were born. I encountered a community whose housing stock had been abandoned by absent landlords, chronically underperforming schools educating children, no supermarkets to supply healthy food choices, and overproliferation of liquor stores, parks unusable by the community because of drug activity, and a hospital suffering from racist underfunding and disinvestment, not unlike today. Yet once inside Harlem Hospital, the OBGYN department, there was leadership committed to rendering the best maternal health care possible. The leadership established a blueprint, a culture, a way of thinking and operating that emanated from the top with clinical skill, quality of care, and continuity, the hallmarks of the care Black mothers received. So as we approach the end of Black Maternal Health Week, Black maternal mortality will be eliminated only when a conscious determination is made that racism is an illness that must be eliminated from the psyche of those with the power to determine if Black lives really matter. When that determination is made, there will be a redistribution of resources that will achieve universal equity for everyone. In the interim, Black women and birthing people's pregnancy, labor, and birth experiences can be made satisfying, sacred through the truthful and honest, sustained focus and coordinated actions at the hospital, local, and state levels. Thank you.
Thank you so much, Pat. I've learned so much from Pat. She's just the best. Next, we'll hear from Councilmember Gutierrez, Jennifer Gutierrez. Thank you.
Thank you so much. And just to echo what Deputy Speaker Ayala said, and I heard all of us were agreeing with you, Mother Pat. It's such a pleasure to hear from you. She comes to every single hearing and testifies. And I know her personally, and I know her in the spirit. And it is honestly one of the biggest privileges to just absorb an ounce of your wisdom every time. So thank you. I want to thank the speaker for her incredible leadership during Black Maternal Health Week. And I just want to emphasize that there are a lot of voices out there that say they are invested in Black Maternal Health Week, but this Speaker Adrienne Adams, has done hands down the most to ensure that we are moving a dial, that we are being inclusive. I know that I can call her personally, and she takes it on. And so I just want to commend you, because it's more than just a press conference when something happens, but I think it's very personal, and I just want to give her flowers, because other people, I think, try to say that they're doing the same. I want to say that I want to thank you as well for helping to center a truth that we don't say enough, which is that we are losing Black women, and too often we lose them after they leave the hospital. Like mentioned before, in January, we lost Tanisha Evans, a mother from Queens who died just 2 weeks after giving birth to twins by C-section. Both her twins, Angel and Liam, don't have their mother. Tanisha's mother doesn't have her daughter. And every year, an average of 20 women die in this city from pregnancy or childbirth-related causes. Black and brown women are the ones dying, and these deaths are not inevitable. They are 100% preventable. 75% of pregnancy-associated deaths among Black mothers and 65% among Latinas could have been prevented. In my own community, we lost multiple mothers to childbirth and errors, and no words can touch on how devastating these losses are. While we are making strides to get Black women more support in the hospital setting, with funding for maternal wing updates, the expansion of the doula pilot program, and other investments, there is another silent killer that here at the Council we are working on to address. It's what happens after birth, during what many call the fourth trimester. That's when we see heart failure, hemorrhage, suicide, overdose, and families navigating the impossible alone. With the Speaker's support, I was able to pass 2 laws focused on this critical window. The Newborn Navigator Act gave new parents the tools, resources, and person-to-person support they need in the first months of their child's life, as well as a citywide campaign to raise awareness about mental health support for new and expecting parents, because too many suffer in silence. But laws alone aren't enough. We need sustained, targeted investment to truly move the needle. We're calling for a baseline of $15.7 million to support maternal health, including the restoration of $12.3 million that Mayor Adams previously cut through PEGS. We're also demanding $5 million for New York City Health and Hospitals to ensure at least one maternal health-focused psychologist in every maternity is present in every maternity department. And while Mayor Adams has claimed his administration is addressing maternal mortality, these critical programs were slashed. The City Council is demanding their full restoration and a basic investment in a proven solution. We need a health system that doesn't dismiss Black women's pain, their experiences. Like Mother Pat said, coercion, that resonated with me. We know it as being gaslit, but it happens way too often. And we need to fight the poverty and racism that leave Black and brown moms without care. I'm a mother of 2. I just gave birth a few months ago, and so this is obviously so personal. And I know that it's personal to so many other members at the City Council. I'm honored to stand here with my colleagues and so proud that this remains a steadfast priority of this Council and of the Speaker. Thank you.
Okay. With that, we will move on. Thank you.